This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. User mistakes in Excel have a long history of being involved in major crises. In 2012, JP Morgan lost $6 billion when an employee copied and pasted the wrong information. In 2010, MI5 put bugs in the phones of more than 100 innocent people because of a formatting error. Someone at Kodak put too many zeros in a column in 2005, causing an accounting anomaly that sent the company's shares tumbling. This year, the spreadsheet software strikes again. This time, 16,000 positive coronavirus cases were lost because the chart had reached its maximum size and couldn't update. Our editorial column, Can't Believe the Shambles.
This is hardly the first problem the supposedly world-beating test and trace program has encountered. It took far too long to set up and is still yet to operate at sufficient capacity. Tests are still not readily available to everyone who needs them. Repeated promises by the Health Secretary that the system will be fixed are yet to be fulfilled. This week's calamity shows we are still some way away. But it is on the success of test and trace that the nation's best hopes rely. Get it right, and not only will lives be saved, but the country will have less need to impose lockdowns and make the painful trade-offs that come with them.
Well, if you're one of Professor Karol Sikora's 337,000 Twitter followers, you may have been surprised to find the normally optimistic doctor admit his anger, calling the situation not good enough. He's with me now. Karol, this is just about unbelievable, isn't it?
I mean, it's just one of a series of errors. You remember way back the way in which the deaths were very sadly counted, and a lot of people who died of cancer and road traffic accidents were counted as COVID deaths by the same agency, Public Health England. And so it's clear it was something so important, so absolutely vital to trying to get society back to normal or some form of normal. It's amazing that this could have happened at this point in time when we've been in this for more than 6 months. Surely we've got systems that can monitor this. The whole test and trace apparatus has completely failed the country.
So adding this extra 16,000 in, it appears to show that the UK is actually where the government expected it to be right now in terms of coronavirus infections.
Absolutely. But what we don't understand is why the hospitalizations haven't gone up. And that's the key. If the hospitalization don't go up, they have gone up a little bit, but it's a very, very small little blip compared to what it was in April. And, the number of spare COVID-style beds available is massive compared with where we've got to with people actually in hospital with COVID. At the moment, the total number of people in hospital with COVID is 2,400. That's right across the UK. So you can imagine all the hospitals everywhere have a few COVID patients in them, not much more than that, and that adds up to 2,400. Many of these people are quite well, and they'll be going home in the next few days. And the entry rate into hospital, the admission rate, is around 400 a day at the moment. It doesn't show any sign of shooting away with itself as it did at the beginning of this pandemic.
Isn't there a problem, Karol, that people might not trust what numbers they're getting from the government if we have such basic mistakes as a problem with an Excel spreadsheet?
I think that's true. The loss of faith in big authority, big government is absolutely clear. And do you believe anything you're told? I mean, forget the conspiracy theories. There's no deliberate policy to confuse. They don't have enough brains to have a deliberate policy to confuse. They're confused enough as it is. But there's no doubt we've got to smarten up our act here. And it's partly because it's multi-agency data. Even things like the test kits, the logistics of the test kits that you do yourself and post back. You've got Amazon delivering, Royal Mail collecting. Royal Mail have done really well. The priority boxes and so on, they can't be faulted. No one seems to be in charge of it. That's the thing. Sitting there in an office with a team of 3 or 4 people, computers, working out how best to do this. and a war room, if you like. You can remember Churchill in his war room in Westminster in the old days. Well, that's the sort of thing I would like to see happening here.
As a doctor, as someone who uses these figures, what do you need to see? What must happen now for you to start trusting them again?
The first thing I need to see is the NHS 111. That's the early warning signal. And that's fantastic. NHS Digital have done a really good job on presenting every day, 24 hours, no argument, it comes up. The second thing is testing, and that is complete mess, both the testing apparatus itself, and we should have much slicker ways of getting packages to patients' homes and getting them tested. The test's not great, having said that, because there are false positives, false negatives. It depends how sensitive you switch up the sensitivity of the PCR test, as it's called. So it's not a great test. It's not like a blood sugar in someone that's diabetic. You can monitor it goes up and down quite smoothly. This is not quite as good as that. It's not an all or nothing thing. But there's no doubt the numbers have got to be smartened up. The presentation of the numbers have got to be made much more logical.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.